partnerships that are transforming the health system. They also believe that they can be able to establish a public recognition platform beyond the public sector. The HIHA Awards aim to also facilitate the public-private partnerships with the health sector and be able to support the private sector partners. So I feel like that is really amazing.
That's a very beautiful thing, I should say. And of course, at a time where our health sector is improving, you can look at, when you look at statistics, Uganda is not where it used to be back then.
We're really
Yet
doing
our health
better.
system is having both private and government-funded facilities. Because when you talk about the government facilities themselves, we have regional referral hospitals that have been refurbished and established in all areas
Aspects
of the country. So that's kudos to the Ministry of Health. Thank you so much for all your efforts, and of course I know you're working better and better every single time to make sure that Ugandans enjoy a proper health sector.
So now, did you know that the Ministry of Health is one of the cabinet level government in the Ministry of Uganda, and it is responsible for the planning of these awards? And they also they have made it a point to be able to deliver, and they've made it a point to maintain an effective and efficient healthcare delivery system that is including the preventive, curative and rehabilitative services in a human, affordable and sustainable manner. I believe gone are the days whereby people could be like that we have issues with accessing health care. I mean, it could be drugs, it could be maybe any kind of treatment. I feel like now we've so much privilege to have different opportunities to get health care. And even before you go into the bit of being treated, like cured, you can have the bit of being doing preventive medicine before you get into the bit of wanting to take drugs. So the Ministry of Health is making a lot of public awareness on combating different conditions. That it could be mental health challenges, it could be NCDs, the non-communicable diseases, it could be the immunizable diseases. The Ministry of Health is really doing a great job, because I think, is it last week or last week? Before last week, we were having the integrated child days in most of the regions here in Uganda. That is in Masindi, in Nakasongola, in Soroti, and even other areas. So they are really doing a great job.
What was the whole intention of the integrated child days?
The whole intention of the Integrated Child Health Days was to track those children that have not been immunized, especially for HPV, those that have not taken their booster dosages, those that have not been immunized for measles, those that have not been immunized for polio, those that have not been immunized for other, so many are different immunizable conditions, because some mothers do not want to take their children to be immunized. And yet it's a cost to the government if a child